My name is Brittany Handler, and this is my day of public health. So, I am one of those people that think breakfast is the most important meal of the day, as influenced by my father. So, I like Honey Nut Cheerios. I don't like just Cheerios because they're not too sweet enough for me. But Honey Nut Cheerios gives me a nice, just sweet enough breakfast, and it gives me a good start to my day, as well as my 1% low-fat milk. For me, it's just right taste, but I also know that it is one of the better meal choices. So with my Honey Nut Cheerios, I'm trying to be aware of my cholesterol, as high cholesterol runs in my family. And with low-fat milk, I just try to make sure I eat right all through the day. So this is my breakfast and my first public health activity for the day. My next step is to brush my teeth. So I have my sensitive toothpaste and my Sonicare because I already have receding gums, so I try to prevent any new irritation as much as possible. So this is something else that I believe counts as public health. It's something I've already put on, but this is the liquid foundation that I put on every morning, and it's SPF 15. So I like that because even in the wintertime and even on today when it's an overcast day, I still know that I have some sun protection on my face. Public Health Initiative 3 I take during my day is to drink this bottle of water at least twice a day. So I'm about halfway through it right now, and so I usually try to finish it by mid-afternoon. Then I have the rest of the day drink my second bottle. This is something I've become pretty aware of within the past year because I find that during the summer I'm obviously really good about drinking water since it's so hot, but as it gets into fall and into the winter I don't drink as much water because I don't really need to be. But I have an app on my phone too that's called Waterlog. I think that's what it's called. Yeah, it's called Waterlog. So I can go in every day and I can just tap on it, and I put in this bottle so I know exactly how much it is. So I can put it in like this, and then if I record the glass, then the little bottle tells me how much I've had and how much I still need to go. And it gives me little reminders throughout the day just so that I'm aware of how things are going, and I can be really conscious of how much water I'm putting into my body since I am moving all day long. And now class is starting again, I need to make sure that I don't have any headaches, that I stay paying attention. So this is definitely something that I work hard to do. So right now I'm actually headed on my way out the door to my first class. So I've got my raincoat on. It's kind of really not very nice day outside today. It's not that cold, but it's also really wet and rainy. So rather than go for my heavy winter coat, I'm going with my raincoat because it's gonna help keep me dry and a little bit warm. So I'm trying to keep myself dry because in this crazy weather, I'm trying to do all I can to make sure I can stay healthy, and I think protecting myself from the elements is definitely the way to do so I can prevent having to go to the doctor's office in like a week. So this is me washing my hands. I usually do so every time I get the opportunity to throughout the day. I scrub all over underneath my fingernails. I say the alphabet in my head to make sure I'm washing my hands for a certain amount of time. And I like to do this just so that I know that throughout the day I'm cleaning off anything I may have encountered to help maintain my own personal health and hygiene. Another thing that I do that is public health related is washing all of my sheets. So I usually do it on a 2-week basis, and I wash everything on hot to make sure I'm getting rid of anything that could be in my sheets after sleeping on them for 14 nights. I'm going off to do that now, but I'm also going to take the stairs down. I try and do this at least a couple times a week. I'm on the 16th floor of my building, so I don't always like to take them back up, but at least going down rather than take the elevator to make sure I get my feet moving. And to making sure I'm taking advantage of sort of the simple things I could do to make my life a little healthier and put a little more walking in there. So I'm off to go wash these so I can have fresh sheets for tonight, and I will take the stairs down to the lobby. So there's the activities I do related to public health on a daily basis. Most of them are around my personal health, personal hygiene.
mostly things taking care of myself. I feel as though on a daily basis, those are some of the easier things to think about when it comes to related to public health. I know in other instances, I would take other measures, such as if I'm riding a bike, I would wear a helmet, and when I'm crossing the street, I make sure I look both ways, and I make sure I'm walking on a safe surface. But today, these are some of the things that I focused on. So it's my first time doing a video like this, so I hope you enjoyed it. I believe it's sort of a fun way to sort of show and tell the public health activities I do throughout the day, rather than just sort of write them on a piece of paper. So I hope you enjoyed watching this, and thank you.